those two gentlemen, and they have always been great supporters.
And so the key thing is needs for developing senior strategy and
What are you going to be speaking about today to the folks at the Community Health Center Alzheimer Society AGM?
I hope to share with people a little bit about my story and what I've learned over the last year in working with the government to help develop a senior strategy for the province of Ontario. I think a lot of that thinking has been influenced by my experience as a geriatrician in Toronto and what my patients have taught me, but also what thousands of Ontarians have also shared with me about what's important to them as they grow up and grow old.
So what are some of the learnings that you'll be sharing with folks? For folks who aren't able to be here today, what are some key findings or key things that you'd like them to know to help with that sort of geriatric health promotion?
Well, I think what was most interesting for me to observe over the past year is the fact that what I like to say is the patients have changed and the system hasn't. So the idea that in 1900, if you were born then, you'd be expected to live about 51 years of age. And when we actually created our current healthcare system back in the 1960s, the average Canadian was only 27 years of age, and most people wouldn't have lived beyond their 60s. So we now don't think twice about living well into our 70s, our 80s, our 90s, or like some of my patients who are already past the 100-year mark. And the question then becomes, well, if we have a system that was designed for a much younger population, maybe it needs to take a rethink about who's actually in front of them, who will be in front of them, as our population that's 65 and better is going to double over the next 20 years. So that's the most interesting thing that I've learned, and what I've been proposing through the work on the senior strategy are real opportunities, learning from all parts of the province about how we can recalibrate our system and recalibrate our thinking to better meet the needs of older Ontarians.
What are the opportunities and the challenges that community health centers might face or step up to in something like that, in a rethink?
Well, I think one of the things that I talk about quite a bit in the report is that the real development of a senior strategy really starts in our communities, and I talk about the development of elder-friendly communities. So the nice thing about community health centers, for example, is that they don't just look at the health issues of patients. What they do really focus on are kind of the health and social care needs of their patients in a real holistic way. So they are places where people can gather and not just kind of meet with clinicians, but they can also attend exercise classes. They can also learn about their illnesses. They can meet other people and do those things. And those are all really important ingredients into developing a stronger and healthier community. So when I look at the role that community health centers play in working with more marginalized populations, like those who are frail and older, or other populations around our province, like our Aboriginal peoples, for example, or those who are homeless or who have mental health issues, community health centers that have a much more holistic approach can certainly really show us how teamwork can occur to really care for these older individuals, but also really provide leadership to the rest of the province in terms of what they can do.